Welcome back to The Full View. The third wave of COVID-19 in South Africa is becoming increasingly deadly. The third wave is taking over the peak of the second wave, and it still has some way to go. Gauteng continues to be very hard hit, still accounting for nearly 60% of cases across this country. But other provinces are expected to feel the pain as the Delta variant rips through South Africa with speed. Let's speak now to senior researcher at the CSIR, Dr. Ridhwaan Suliman. Dr. Suliman, it's always great to have you with us. Although the numbers are particularly grim, let's start with your graph looking at the average daily cases and the test positivity rate as well in South Africa.
Hi Francis, lovely to chat with you again. Indeed, the numbers are looking quite concerning at the moment. If we look at the number of reported COVID-19 cases nationally, it's now up to almost 19,000 cases per day on average over the past week. And concerningly, that figure is set to surpass the peak of the second wave as we see the latest numbers being released later this evening. So the 7-day average of cases is up 28% compared to a week ago now. Testing has increased, though, too, over the past week. We're conducting almost 69,000 tests per day on average over the last week, indicative of more people presenting for testing. However, of concern still is that the test positivity rate, or the proportion of those tests returning positive results, is still increasing and now up to over 27% on average across the country. That's 1 in every 3 to 4 tests returning a positive result.
Sure. So a lot of people who are going are actually COVID positive, and of course that's the situation in Gauteng. Before we look at Gauteng, I believe you've got a comparison of the third wave versus the second wave versus the first wave, and looking back, I mean, that was as bad as we thought it was going to get. It's so much worse now.
Yeah, unfortunately, the third wave is worse and is surpassing what we were seeing during that very bad second wave that we saw over December and January this year. So nationally, the case incidence is at 33 new cases per 100,000 per day, and that's set to surpass the peak of the second wave in January. And unfortunately, it's still rising as we still see an increase in Gauteng, but we now see an increase across all other provinces too, and concerningly in the other big provinces as well.
All right, like you say, we're about to pass the peak there of the second wave. We brought up the graph already erroneously. Let's go back to that comparison of the waves, particularly in Gauteng, where COVID-19 is just soaring incredibly at the moment.
Indeed, Gauteng remains the epicenter of the third wave in South Africa, accounting for just over 60% of total cases reported nationally. Over the past week, there have been over 82,000 cases reported just in Gauteng. And as you can see by this concerning figure, is that the current third wave trajectory in Gauteng is now 2.2 times higher than the previous peaks and still rising. Started to show a slowdown for a few days, but unfortunately the last few days have seen another spike again. So this is quite a concerning situation in Gauteng, and already hospitals are overwhelmed, and the deaths in Gauteng increasing significantly too.
And no sign of coming down that graph. It just looks like it's going to go up for a while, Doctor.
This is a concern. I mean, it started to show a decrease just earlier in the week, and we were hoping that it sort of passed an inflection point where cases are decelerating or slowing down and heading towards the peak. But over the last 3 to 4 days, the numbers have indicated another spike again, where you can see that the curve is sort of bent upwards again concerningly. The trajectory in Gauteng is due to peak right now. When it will happen still is very difficult to actually predict.
All right, now the concern is that other provinces may be better off for now, but because of Delta, they don't have the immunity that they do to the other variants, and they could also feel the pain. Let's look at the provinces and give us a sense of the picture in other provinces like KwaZulu-Natal.
Absolutely. While Gauteng is a concern, we can't forget that the situation is really turning in all of the provinces. I think first to point out is all of the neighboring provinces of Gauteng are seeing a significant rise. Notably in Northwest, the case incidence is now 50% higher than what it saw at its previous peak. And is now at its highest point in its epidemic since the start. Concerningly too is Limpopo, Mpumalanga are also on a significant increase, and even Free State, which is showing a decrease for a number of weeks, showed a slight uptick this past week, up 12%. Of the other big provinces, as you indicated, KwaZulu-Natal is a concern. While the case incidence is still low, cases have increased by 60% in Gauteng this past week compared to the previous week. And that being another densely populated province really is a concern. It's about 3 weeks behind Gauteng's epidemiological trajectory. And I think also to point out is Western Cape's rise at the moment. It's about 2 weeks behind Gauteng and increased by 34% this past week, and already has surpassed its peak, its first peak that it experienced a year ago.
All right, so this could move the intensity of this third wave right now. Gauteng is the epicenter, but we could see other really concerning provinces soon. What is the test positivity rate saying in the provinces?
Yeah, so the test positivity rates per province really do confirm the trends that we are seeing in cases. Gauteng's test positivity rate up to 37%, its highest it's experienced since the start of the epidemic. It means that 1 in every 2 to 3 tests conducted in the province is returning a positive result. Limpopo's test positivity rate has risen quite sharply. Northwest also on the rise, both above 30%. And Mpumalanga and Western Cape above 20%, so all at concerning levels there. Free State also, like what we saw in the cases, having seen a decrease, now showing a slight increase in test positivity too, but all of the remaining provinces also above 10%, so all really of concern right now.
Yeah. All right, let's move to hospital admissions, and we'll zoom in on Gauteng. But firstly, obviously, this sort of follows as the infections rise, so the hospital admissions rise. What is the South African picture first?
Yes, concerningly, following the increase in infections that we have been seeing across the country, we're now seeing a significant rise in hospitalizations and also in death, sadly. Nationally, the number of new admissions across the country last week was just over 9,500, and that figure has increased by 26% week on week. A significant, over 50% of those are in Gauteng, but I think to also point out is that there's been a notable increase in new hospital admissions in Western Cape, in Limpopo, in KwaZulu-Natal. All of those 3 provinces have increased by 50 to 60%, but also a rise in admissions in the Northwest, where new hospital admissions are now at levels that it saw during the peaks of its previous wave.
Yeah, and I mean here it looks like we're nowhere near the peak of the second wave if we continue on this graph, but the trajectory is the problem, and this will be a test of whether or not we prepared hospitals.
Absolutely. Remember that there's a lag in terms of when we start seeing a rise in infections to when we see the rise in hospitalizations. So we can continue to expect that the hospitalizations will increase even for at least 2 weeks after we have started to peak in terms of cases and started to slow down. So that number will unfortunately continue to increase, and I think all provincial health departments do really need to prepare for that rise. In Gauteng, we're seeing that hospitals are overwhelmed, and I hope that the other provinces are taking note of that. Northwest already at its highest levels, and so we need to prepare hospitals, beds, oxygen capacity, but also ensure that we have sufficient staff capacity to actually man those beds too.
All right, let's return to the graph looking at hospital admissions specifically in Gauteng, where we're way past the second wave peak, haven't we, Ridhwaan?
Yeah, unfortunately, following the trajectory in cases, the hospitalizations in Gauteng have now surpassed previous peaks as well. The last week saw over 5,200 new hospital admissions just in Gauteng, and that has, as mentioned, surpassed what the province saw at the previous peaks. There are currently over 7,800 patients in hospitals in Gauteng due to COVID-19, and over 1,360 patients in ICU. All of those numbers higher than what the province saw during the previous waves.
Yeah, very sad what some hospitals are seeing, and even grimmer, you have to look at death stats. What are we seeing? You know, the Delta variant we knew was much more transmissible. Apparently not more deadly, more research perhaps needed on that. Is that coming through?
Yeah, so no scientific evidence that the Delta variant is more virulent or more deadly. What we are seeing is that it certainly is a lot more transmissible, so a greater absolute number of people being infected, which unfortunately then just translates to higher people needing to be hospitalized, and then sadly more people succumbing to the virus. At this stage, we're starting to see a significant rise in the number of reported COVID-19 deaths across the country. Over the last week, that figure is up to 247 deaths on average per day, and that has increased by 45% week on week. In other words, new COVID-19 deaths have doubled in less than 2 weeks, under the past 2 weeks. It's at a level which is similar to what we saw during the peak of the first wave a year ago. Unfortunately, this will continue to increase as we see hospital admissions on the rise. Whether or not the Delta variant is more deadly remains to be seen. Hopefully, there is, with some prior infection, there is some level of natural immunity within the community that will hopefully prevent or limit the severe illness and the extent of the deaths that we do experience during this wave.
All right, thank you for those graphs. Finally, Dr. Suliman, I mean, it feels like we're in the brace position, certainly here in Gauteng, sort of waiting for this wave to pass. It's been incredibly damaging. It seems like it's spreading like wildfire at the moment. And can you say when it could peak?
Francis, it's very difficult to predict right now, especially as we're dealing with a very highly transmissible variant. As indicated earlier, we were expecting that Gauteng's third wave trajectory should have slowed down and reached a peak, but it hasn't just yet. Hopefully, we'll start seeing some effect of the recent level 4 restrictions that took effect this past Monday, the 28th of June. So hopefully, over the coming week, we might see some promising signs first in Gauteng, and then hopefully there'll be a more significant effect in the other provinces. But I think we can still continue to expect a rise in the other big provinces, particularly Western Cape, KwaZulu-Natal, and Eastern Cape. Their trajectory is just 2 to 3 weeks behind Gauteng's, and so we just need to expect and prepare for the increase that we will see there.
All right, thank you very much. CSIR Senior Researcher Dr. Ridhwaan Suliman. Let's look at vaccines now.